Hello, everyone. Thank you for joining us today for our virtual open enrollment fair session. At this time, we will go over Kaiser Permanente medical benefits. Before we get started, I would like to brief everyone on a couple of housekeeping items. All attendees are muted and will remain muted throughout the presentation. If you have a question, please type it in the chat box located directly to the right-hand side of the screen. Be informed that if you do type a question in the chat box, everyone attending the session will see your name and your question. So if you do have a question that is confidential or sensitive in nature, please reach out to the County Benefits Division or your departmental benefits ambassador. Lastly, today's webinar is being recorded, and a copy will be placed on the Benefits Open Enrollment website. At this time, I will turn it over to our presenter, Charlotte Souza.
Thank you, Nidra. Good afternoon, everyone. My name is Charlotte Souza. I am a Kaiser Permanente representative. I've been an employee of Kaiser and member for almost 30 years. I have children that were born at Kaiser Permanente as well as grandchildren. I'm definitely a big Kaiser fan. I'm here to provide you with an overview about Kaiser Permanente. If for those of you who have been with Kaiser Permanente in the past or are current Kaiser Permanente members, there are some updates that we've implemented, and this is also an update for you as well. With that, let's get started. Now, Kaiser Permanente is a nonprofit organization, one of the largest here in the country. We own and operate our own facilities, as many of you know. When you become a Kaiser Permanente member, you utilize the services at the Kaiser Permanente facilities. Our doctors, our specialists are located there, as well as urgent care, pharmacy, and lab. The nice thing is all these different departments, most of them have all these departments, so which that allows you not to be traveling all over town. You get these services in one place, saving a lot of time and also being convenient. We've been around for over 75 years. We have 12.6 million members, and we are not just in California, we are in 9 other states as well. And together with a very robust electronic medical record, it just makes it very easy to provide care for you and effective care. You're getting the quality of care that you need. And you can see right here that with the electronic medical record, all the different departments, including telehealth services and your insurance, which is Kaiser Permanente, all are connected where you are at the center. Now, our doctors at Kaiser Permanente, as a member, you utilize the services and your care is with a Kaiser Permanente doctor. These doctors come from the best schools all over the country. They come in, they don't have to worry about running a business. Their focus is the care of our patients. They're paid on a salaried basis. They have the electronic medical record, which makes it more effective to take care of our members. And a lot of these doctors are bilingual. We do have the interpretive services of up to 150 languages as well. Remember, you can change doctors anytime or as many times as you would like. The change is immediate. And one thing I do want to mention, the majority of our doctors, over 90% of our doctors are board certified, which is a credential that is highly recognized in the medical profession. And you can go on kp.org/doctors to look at their profiles, how long they've been with Kaiser Permanente, their areas of expertise, what languages they speak, male, female, and so much more. You can also have access to the specialist profiles as well. Now, when you're visiting our facilities, I mentioned that you get your care in one place, which makes it very convenient for you. And then also, you have the ability to have same-day appointments, next-day appointments. Some of our facilities also do weekend appointments that are for routine. Of course, if it's an urgent need, you go to one of our urgent care centers. And I do want to mention that with that electronic medical record, you as a member, it just makes it easier on you. If the doctor sends you to a specialist after reviewing tests, having tests done, labs, x-rays, and everything, the doctor that refers you, you're referred to a specialist. That specialist can see the same information, the labs that were ordered. So you don't have to be duplicating efforts because everybody sees the same information. Now, with that, as a member, you have access to part of your electronic record. You register in kp.org and you can communicate with your doctor for non-urgent questions. You can book appointments, cancel appointments. One of my favorite features is viewing lab results. As soon as you get your lab works, a lot of the results come in right away. You can see your lab work results and you can do a little bit of research. You can see how long they've, are they within normal ranges? If not, how long. You can see the history of that particular lab that you had done. And it just helps you be more proactive with your care. And then you can also pay bills online as well. Once you're registered in kp.org, you have access to it on your mobile device, whether it's a smartphone or a tablet. And you have so many different capabilities. And you also have an electronic ID card that you can use instead of carrying your regular ID card. Or if you have an emergency, you don't have your card, you can also pull it from the your iPhone, smartphone or tablet. One thing I do want to mention is you also have what you call personal action plan. What that means is your preventive care that's due based on your age, your gender, or if you have chronic conditions. It also alerts you, hey, you're due for your mammogram, you're due for your colonoscopy. It gives you alerts, so it keeps you on track with regards to your preventive care. Another piece is that you have access to telephone and video visits with your own doctor. And for your traditional HMO plan, your high plan, the telephone and video visits are available at no cost. If you're on the high deductible health plan, it comes with a fee all the way up to once you meet the deductible, then it's available at no cost. But the cost, the fee would probably be slightly less than if it would be in person. And then you see this Get Care 24/7 online. That is a new feature that was implemented last year, earlier in the year, which means that we have clinicians that are on call and available that have access to the electronic medical record. And you see that feature on your electronic record, you click on it and it'll tell you how long is the wait to see that or speak to or video visit with that clinician. And again, they're available 24/7, which is slightly different than communicating with your doctor or having a telephone routine appointment with your doctor. This one is Get Care Now, which is talking to a clinician. Now, one thing we added last year that's new is for your pharmacy refills, when you have it mailed to your home, postage is not, it's at no cost to you. You only pay your copay, and if you pay 2 copays, you get up to 100 days for your maintenance medication, such as your high blood pressure medication, thyroid, cholesterol, diabetes. You get up to 100 days supply for that. Now, if you wish to have a same day pickup, a same day or next day delivery, that is now available, although there's fees do apply for that particular service, but that's something new. And then of course you have the option of ordering the prescription and just have it picked up at one of the locations anywhere that's close to you that you select as well. Now, if you travel, you are covered for emergencies worldwide for urgent care and emergency. We do have a travel line that's available, and you can call when you're planning your trip or when you are already on your trip, during your trip, or after your trip. They are there to answer your questions. You can also go on kp.org/travel to learn more about your travel benefits. And this right here just tells you of your coverage, whether it's international or within the United States. And then the next one does have additional information if you're traveling within the United States. In this map, you can see where Kaiser Permanente is available, and you can access any of those locations as if you were here in your home area. And they're available for routine care as well, for the most part. You can always look into that as to what types of services may not be covered, but it's mostly routine, urgent, or emergency. If you happen to be outside of those Kaiser Permanente states, we have partnered with minute clinics that include pharmacies, Concentra urgent care centers, and in the Midwest, we've partnered with little clinics that also include a pharmacy. And then last year, towards the third, fourth quarter, we've partnered with Cigna PPO Network. And these are for your urgent care needs. Oh, I forgot, we are also in Hawaii. But your urgent care needs, and what that means to you is basically if you have an urgent need, you go to one of these providers, you only pay your copay. So you don't have to be getting your receipts, your paperwork, making copies, sending it in and filing a claim and getting reimbursed minus your cost share. You're free from all that. You only pay your copay. And for the minute clinic that has a pharmacy, if the doctor provides a prescription, you can use a pharmacy and pay your copay for that visit. You can use the pharmacies for that. So again, just making it more convenient for you. And then we also have the 24-hour care. We have those clinicians that have licenses in most of the states as well, and you can call a clinician as well. So because of our electronic medical record, we're able to capture all this information and provide better care for our members. So our members are 33% more likely to survive heart disease because we can detect things earlier. And then colorectal cancer screening, 52% more likely to survive that. And then 20% less likely to experience premature death due to cancer. We are very, very strong on prevention. And the fact is that if you go to a dermatologist or you go to a different department within Kaiser Permanente, they all see that you're due for a preventive care. So they'll let you know that if you would like to make an appointment at that time. So again, very, very proactive in prevention. For maternity care, we have a very comprehensive care team for our new mothers or our expectant mothers. And also early detection, such as high blood pressure, is key. They look at your electronic medical record and make sure that your plan is tailored to our new mothers or expectant mothers. There's also classes on nutrition, infant care, and so much more, just to have a healthy pregnancy and a healthy baby. The KP.org website also has, it's pretty comprehensive, and it goes through every stage of the pregnancy and each trimester, what to expect, and throughout your pregnancy. It has articles, and it also has virtual tours that the expected mothers can view before they deliver. Now, resources for mental health. We cover anywhere from anxiety all the way to addiction, depression, autistic spectrum disorders. We have psychiatrists, psychologists, therapists that you can see. You can call them directly. You do not need a referral from your Kaiser Permanente doctor. You can see your providers on a one-on-one basis and pay your copay if it's in person. If it's via telephone or video, then the copay it's free with the high plan, the traditional HMO, and there's a small fee for the high deductible health plan if you haven't met your deductible yet. So again, it's available to everyone, and again, you do not need a referral from your Kaiser Permanente doctor. So this pretty much covers a lot of the different ways mental health, because it's such a huge it covers so many different things. We're available anytime. And for Southern California, there's this new 800 number that members can call, and they will be directed to the right care. If you can also to contact your primary care doctor, talk to your doctor. They're equipped to assess the situation and refer you to the right place as well. Our clinicians. And then our specialty care, if it's a 911 type of emergency, go to a nearest hospital or call 911. And then, of course, we have self-care apps and health education courses that I will talk to you about shortly. This sort of provides the same information, but in a more, in paragraphs where you can see much easier who you call depending on the need. And again, you have a wealth of resources on the wellness section as well, and we will be covering that for you. So you have, as with Kaiser Permanente, self-care apps. They're available to you at no cost. These are for reducing stress, improving your sleep, your overall mental health wellness. These are slightly different. What you do when you're on your kp.org website, you go into the self-care app section, you look at the app that you want, select it, create a user ID and password, and then you can download it on your smartphone or your tablet and take advantage of all the different services or features that it offers. The Calm app is very popular. It's mostly known for meditation, but there's a lot of great stuff in it. Practicing mindfulness, sleep stories for your children. My son uses it to help him sleep, and so much more. It's a very handy one, very popular. The it's free to you, but if you were to, it's the upgraded version too. So if you were to download it off of the regular application store, it would have a cost. The Ginger app is somewhat the same, but it's more of a text on a one-on-one basis with a emotional support coach. They're available 24/7. And again, it is text-based. I'll give you more details shortly. The My Strength app is more of a changing behavior. It was approved by our clinicians to make sure that it was safe, and for us to be able to offer it to our members. And it basically has tracking tools, and it checks on you from time to time. You get an email, how's your day? And it's pretty cool. I tried it myself. So take advantage of these features. A little bit more of the Ginger app, because this was introduced last year. You are texting with a coach, and they're available 24/7. But once you start, it's available for 90 days. Then end of the year, it resets and you start all over again. But it's a temporary one. It has skill building tools, a library of over 200 activities. You can discuss goals, share some challenges, and create actions plans with these coaches. And then you can view the recaps from each of your sessions that you have with these coaches. But it's I haven't tried this one myself, but I hear that it's very, very, very effective. And again, if you're seeing a therapist, this does not replace a therapy visit. These are just add-ons, or if it's just to reduce anxiety, help you sleep, these are a great way to take advantage of these features and take advantage of all these benefits and resources available to you. So let's talk a little bit about your wellness tools and resources. Again, taking care of yourself, not just when you're sick, but also when you're healthy. Gym membership, acupuncture, massage therapy. Let's talk a little bit about that, as well as our telephone coaching and ClassPass. ClassPass, that's another app that's available for you. This is for workouts. It does have discounts for gyms throughout the community, but it also has online video workouts at no cost. They're free, they're on demand, and it's over 4,000 of them. It's on, yoga, Pilates, kickboxing, training. The one that I liked, and I used a little bit of it, was the strength training for upper or lower. And then they just included dance, if you like to just dance and just keep active. Again, free on-demand videos, over 4,000 of them. And this is another tool. ClassPass, we've had it for more than a couple of years now. Telephone coaching. This is a great resource as well. The telephone coaches are for nutrition, fitness, weight reduction, stress reduction, and smoking cessation. What you do is you set up a call, and the first call is lasts a little longer, about 20 minutes to set up, get your information, and then you can join these calls every week, every other week. It's all up to you. These coaches are experts in the field in the topic that you choose. They also have access to the electronic medical record, which means that if you have a chronic condition, for example, high blood pressure, diabetes, they will tailor the plan and make adjustments to your goals, and it just makes it easier on you. Again, this is a benefit that's part of your entire benefit plan, and again, this is free to you. The website, or actually kp.org, has a wealth of resources. It has encyclopedias, alternative medicine library if you want to know more about that. It has videos on cooking demonstration, and you can see right here, it also has hundreds of healthy cooking recipes, meal planning, and so much more. And the kp.org website for these services, it's available to the public, not just Kaiser Permanente members. But take advantage, again, healthy cooking recipes. You can tailor it based on what you're looking for, whether it's lunch, dinner, if you're vegetarian, or you would like simple ingredients, or kid-friendly types of menus as well. There are health education classes available at no cost, and the majority of them are at no cost. And a lot of the great classes are on sleeping well, taking care of your heart, emotional health, and the healthy balance class. These are all free to you, part of your benefit. And the majority of them are still virtual. Some of them, because of the need, they have turned it back into in person. And again, take advantage of these. The emotional health one, it's an 8-session class, and the healthy balance class is very popular within the county community. When I'm out there in the field and I'm talking to someone from the county, they have taken this class, they love it, they want to take it again, because it covers all the different components: the nutrition, the exercise, the mental health, even reading labels, and it's I believe a 10-session class. And the healthy balance class is available to the public, but it is at a fee. Now, you also have web-based coaching. You may be familiar with this one. You have the total health assessment you can fill out, and then you can join interactive programs on reducing stress, improving your mood, helping you sleep, and so much more. If you rather do web-based, that's available. You can do all of them. It's all up to you. As a member of Kaiser Permanente, you have discounts on acupuncture, massage therapy, chiropractic. The resource also has a library of articles, and this is through American Specialty Health, which is one of our partnered providers. And you call them directly. You don't need a referral from your Kaiser Permanente doctor, and you just pay your appointment, and the discount is already added. So take advantage of these services. Again, you don't need a referral from your Kaiser Permanente doctor. It's acupuncture, massage therapy, and chiropractic. The Active and Fit is over 12,000 fitness centers all over the country, and with $28 a month with a $28 enrollment fee. and I believe you have to pay for the first 2 months. You can join any of these fitness centers. You can go online, put your zip code, and do a radius of 20 miles or 30 miles, and it'll download a list of the different fitness centers available in your community. I do know that the LA Fitness gyms are in there, Curves. I believe the 24-hour fitness is not there. So the last time I checked. So I'm going to check again just so I'm updated. But again, you have these services available to you as a member. In San Diego, we have a Positive Choice Integrated Wellness Center. It's located at the Garfield facility in Kearny Mesa, Claremont Mesa area. And this wellness center has a lot of great services and resources that's available to the public. And the website is pretty cool. It's positivechoice.org. They do the full liquid diets, and I heard they're very effective, all the way to half liquid diet, half meal plan, or just meal plans. They have all these different types of weight management programs, but again, those are at a fee. But there's a lot of different resources. Sometimes they have webinars that are available at no cost. And again, available to the public. And I think, yeah, but anyways, look at this. It has a lot of videos on biofeedback, breathing exercises, and so much more. Okay, so let's talk a little bit about your benefits in the next slide. And I'll just point out where the change took place. And basically, for the traditional HMO plan, there are no changes. You continue as is. There is no deductible for the traditional HMO plan. The maximum yearly out-of-pocket, what that means is if you've been paying your copays, including your prescription, if you reach $1,500 as individual or $3,000 for family, all that means is that if you reach that, you don't have to pay anything for the rest of the year. Any of the covered services, your doctor visits, your labs, your pharmacy, all that is covered. The health plan takes over, and you don't have to pay for that. Once the year ends, first of the year, it resets, and you do start all over again. The preventive is covered at 100%, similar to your telephone and video visits, as well as your laboratory test and radiology, all covered at 100%. If you visit your doctor, whether it's a specialist or urgent care, the copay is $25. This includes any outpatient surgery that's done at the outpatient surgery centers. If you're hospitalized, the copay is $100. It's per admission, so it doesn't matter how long you are in the hospital. If you're sent home and a month later you need to be hospitalized again, then you would pay another $100. And again, that is per admission. Now, if you go to the emergency room, remember, emergency care, the rooms are for life-threatening to your health. If you go there, the copay is $125, waived if you're admitted to the hospital, then you would pay the $100. A lot of the emergency care services should be going to urgent care. And again, if you have an emergency and you feel, your life or health is at risk, then you go to the emergency room. Prescriptions, your medications, it's a $10 copay for your generic medication. And for your brand medication, it's a $30 copay. Now, if you are taking maintenance medication and you have it mailed to your home, you call it in, have it mailed to your home, or you order it online, you pay 2 copays and you get up to 100-day supply. So just making it easier, saving yourself some money and a trip to the pharmacy. Now, the HSA High Deductible Health Plan, this is a very interesting product. It's a product that, yes, it has a high deductible, but if you can set up a bank account, and I believe Optum is the one that's offered to you with the county. You set up an account and you can save federal tax dollars on these to pay for your services. And the deductible for this plan did go to $1,600 for self, and it went to $3,200 for individual in a family. Total for the family is $3,200. So whether it's individual or the entire family, the deductible is $3,200. So that's the big change. The other change also is the out-of-pocket maximum was moved to $3,200 for self, and then for individual, $3,200. So once they met their deductible, they met their out-of-pocket maximum. So a family is $6,400. So this type of product is regulated by the IRS, and these are the new benefits because of the new regulation. Again, if you have covered through a family, if one person in the family reaches $3,200, even though you haven't met the family out-of-pocket maximum, that one person in the family can then the benefits start kicking in. For example, they start paying the co-insurance for the plans or a copay for the prescription. So preventive, whether you whether you met your deductible or not, is covered at 100%. Remember, these are your physicals, your cancer screenings, mammograms, the cervical cancer screenings. As you get older, the colonoscopies, sigmoidoscopies, all that is part of preventive. That is covered at 100%. The rest of these services, the doctor visits, the surgery, the hospitalization, the emergency, it's a 10% co-insurance after you have met your deductible. Once, if you get to the out-of-pocket maximum, then again, the health plan takes over 100%, and you're don't have to pay anything till the end of the year. Let's see. The telephone and video visits, once you meet the deductible, then it's available at no charge. The copays for generic is a $10 copay, and for brand, it's a $30 copay. And again, you can take advantage of the mail order similar to the traditional HMO plan. But the biggest change is the deductible and the out-of-pocket did go up slightly, and this is due to the IRS regulation. And also, I'll pause here to see if there's any questions, Nidra.
Sure. We did have a few questions come through the chat that I've answered, but I would like to read them out loud for anyone else who has an interest in having this information. So there was a question about the rates, and you've gone over those, specifically informing that it's part of regulations. But I'd also like to share with those who are present that the changes in your deductions come out of your paychecks. Those rates are pretty much contracted rates that we truly have no control over, and we cannot go into any details during this webinar. But if you have had an opportunity to look over the open enrollment website, you'll see that there has been a significant increase with the Kaiser premiums. Again, those are based on our contracted rates. We did also have a question come in regarding chiropractor. Does Kaiser have chiropractor services? And the answer to that is no, unfortunately. We do not have chiropractic coverage. But if you do go to the kp.org website, there should be some information there for you to at least get some discounts for those types of services. So that's about it. That's what we have so far. I'll give it back to you, Charlotte.
Thank you, Nidra. Okay, so we are here for you. So let us know if you have any questions. We'll pause again shortly Thank you so much, Nidra. For the high deductible health plan, it's a deductible type of plan. So you have additional services if you're registered on kp.org. You can pay bills online. You can view some of the explanation of benefits, review your benefits. You can track your deductible or your out-of-pocket maximum, any status of claims. There's an estimation tool that is pretty sophisticated. So if you're planning a procedure in the future, you can go online and it'll take into account your benefits and it'll give you what the cost would be to you. If the cost is pretty high, call member services so you can start a payment plan. They'll work with you in regards to that. This just shows a sample of what the cost estimation tool looks like. Again, office visits, what that would cost, knee surgery. It just has that information there for you. Now, after your visit, you would receive an explanation of benefits. This is just detailing what the cost was, what was part of the deductible, how it got deducted, and what is your responsibility. And you have access to this on your kp.org account as well, but you would be receiving one of these explanation of benefits that provides you that information. You have a dedicated microsite that was created for you. It's customized. There's a QR code that will take you in there. And what it is just welcomes you as a County of San Diego employee. And it has some of the more personalized tiles that would benefit you here in San Diego, being a Kaiser Permanente member. Here's a new San Marcos facility, maternity care, and for those of you who are interested in the HSA high deductible health plan, there's a video on that. And again, it's personalized more, but it does have a lot of the kp.org features. But this one includes, we house your benefit summaries, your SBCs, and your evidence of coverage as well. And just so you know, the quality of care that you're getting, the National Committee of Quality Assurances, these are all organizations outside of the health plans that they audit the health plans and they look at so many things, such as, the quality of care, customer service. They look at so many different processes and they provide a rating. Kaiser has earned the top rate in the state for the 7th year in a row. You have the best in state for behavioral health and mental health. And then the HEDIS report, which has, again, rates the health plans. It looks at preventive care, processing claims, pharmacy, 74 different processes, and HEDIS has provided Kaiser a high rate as well. So looking at the maps, this is just a snapshot of what Northern California looks like. These are just sample service areas in that location. Here's Southern California. You can see San Diego down here. We're sort of a little over here, not too far from Los Angeles, but we're in San Bernardino, the Inland Empire area, and northern Los Angeles as well. Here's just some of the new facilities that opened. Claremont Mesa Boulevard is probably 3 years now. I remember when it opened. So that was not too far from the actual Kaiser Permanente Hospital. And then our San Marcos Hospital that opened about a month and a half ago. And it has a lot of the same capabilities as the Kearny Mesa Hospital, state-of-the-art, technologically advanced, robotic surgery, private rooms for our patients. This is huge for our mothers, our new mothers. This was a big ask by our new moms that were members of Kaiser Permanente. It also includes the intensive care unit for newborns as well. So in Southern California, we have an added benefit to our Southern California members. This is the Target Clinics. So they handle minor injuries and minor illnesses. You can also get your flu shot there. You can get a sports physical there. They're available Monday through Friday from 9 in the morning to 7 p.m. at night. And then they're available on the weekends from 11 to 4. But they're closed for lunch. The ones in San Diego County are Chula Vista, Encinitas, Mission Valley, Santee, and Vista. And they do take walk-ins, but you can also go on kptargetclinic.org and make an appointment. That way you don't have to wait too long because they do take walk-ins. And our providers are housed there, so they're seeing our members as well, and they have access to the electronic medical record, which means that your care that's there is recorded and your doctor can see that information. If they give you a prescription at that time for that visit, you can use that pharmacy for that visit and just pay your copay. But again, you would just pay your whatever your cost share is at that time. Any refills after that, you do have to coordinate with your doctor, or if any care in addition to that you need follow-up care, you need to go back to your regular doctor for that. But again, this is an added benefit that's available to our Southern California members. In the newer facilities, there was a new one that in Seal Beach that has been added, and in Los Angeles over at Moore Park, those are our newer ones that have been added to the list. If you're new planning to join Kaiser Permanente, we do have experts that can onboard you. This team will help you choose a Kaiser Permanente doctor, transition your care and your prescriptions as well. Once the effective date takes place, if you're running low on medications and your visit is in a week or two, we do provide a 30-day courtesy supply to give you enough time to see your new doctor. But they'll assist you with transferring and transitioning over to your Kaiser Permanente doctor and making the appointment. So I reviewed some of the membership perks that we offer. Our access 24/7 care by video or phone. Some of the benefits, everything that we offer as a Kaiser Permanente member to our members. So again, you have a wealth of resources in addition to the high quality care. Thank you so much. If you have any questions after this call, you can contact your county benefits division team. They know a lot about Kaiser Permanente, or you can call member services if you're a current member with Kaiser Permanente as well. Thank you so much, and thank you for having me. I'll turn it over to you, Nidra. If any questions.
Thank you, Charlotte. Yes, we do have some more questions to go over. Let's see here. And this is pertaining to overseas care. If I need medical care overseas, does the traditional HMO plan cover the visit to regular clinics to get urgent care, such as COVID or a visit to emergency department?
So you are covered for emergencies worldwide. If it's outside of the country, you may be paying for the visit. When you come back, you would file a claim, and Kaiser Permanente would reimburse you minus whatever the cost share would be.
Okay. And for the high deductible health plan, how much are they expected to pay for telephone or video visits if the deductible is not yet met?
So a regular office visit in person ranges from 100 to 400 average. So it all depends on the level of care that you're getting. And so the telephone or video visits would be under that. So it all depends on the level of care, whatever they do in that visit, but it wouldn't be as much as a regular office visit with in person with your doctor. I can't give you an exact amount because it's usually an estimate, but it would be less than whatever it would cost as an in-person visit.
Got it. And speaking of rates, another question that might fall in line with your response to that. Do you have the rates of how much it would be when it comes to childbirth hospitalization?
Childbirth. You know, the estimation tool is when you're already a member of Kaiser Permanente. If it's a prospective member, I would call member services. I don't have that amount. There's a sample fee list on this customized website that you can access, but I would call this number. Let me see if I can find that number. This number right here, and they can provide you with that amount, that average amount.
Well, we did regarding our what's new flyer, what's new for 2024 open enrollment flyer. And the employee has asked about the flex credits, and where it mentions the flex credits are the county's contribution to offset your out-of-pocket expenses. So they wanted a little more clarification on that, and I'm happy to share that with the rest of the audience. Typically, when we see increases with our benefits in the new year, they typically do not exceed 5%. And so we do get the 5% flex credits regardless of what we expect to see with the medical, dental, vision plan increases. So the flex credits will absorb those increases. On the downside, Kaiser, sorry, Charlotte, their increase is more than 5%. We're seeing approximately 14%. So the will not entirely cover any of the Kaiser premiums. But again, the good news is the 5% on the flex credits covers increases on the other. So I hope that answers your question. Keep these great questions flowing in, everyone. Charlotte, since it looks like we're taking a pause in the chat as far as questions are concerned, can you run through your PowerPoint another time? And maybe
Sure.
we can get some questions flowing from individuals who may have perhaps joined in late and missed the beginning. So,
Okay.
thank you.
I don't know what it's an easy way to go all the way to a front, so I'm going by slide. Okay.
We're
So
right there with you. Thank you, Charlotte.
Yeah. Oh, you're welcome. You're welcome. So, for those of you who got here a little bit later, we're just going to review the presentation just to make sure if we covered your questions, we were able to respond to them. Again, Kaiser Permanente is a nonprofit organization. We own and operate our own facility, and we've been around for over 75 years. Our facilities have everything you would need, or most of them, everything you would need for your care. Primary care division filled with family doctors and internists, pharmacy, laboratory, and x-ray. So you get all your care in one place. You don't have to be traveling all over town. A lot of these facilities, in addition to that, have specialty care, urgent care, and outpatient surgery. So again, it just makes it easier on you, especially if you have a sick baby. It's hard to go in and out, in and out. We have a very robust electronic medical record, and allows our doctors to provide more effective care and quality care to our members. And you can see on this diagram where we are connected with primary care, specialty care, pharmacy, and lab. Our telehealth services are also integrated. where your telephone and video visits are with your own doctor or your own specialist, and then the health plan. And this pretty much, all of these are connected where you are at the center. Our doctors, our Kaiser Permanente doctors, they do not contract with any other health plan. They only see Kaiser Permanente members. They come from the best schools all over the country. They don't have to worry about running a business, paying rent, paying the phone bill. They only focus on the care of our patients. And with the electronic health record, it just provides them all the tools that they need to provide that quality of care. If you go on kp.org/doctors, you can see their profiles, how long they've been with Kaiser Permanente, what schools they went to, if they teach, what universities they teach, or a lot of our doctors are professors at the leading universities. And remember, you can change doctors anytime or as many times as you would like. If you commute, let's say you work in San Diego but live in Temecula or vice versa, Murrieta, and your doctor is in where you work. But you go home and in the weekend or you're on vacation, you don't feel well, you can call and make an appointment with a doctor in your area or go to the nearest urgent care center. So there's a lot of flexibility right there. Oh, let's see. Now, we do have same-day appointments too. If your doctor's not available, of course, you can see someone in his team as well. And also there's next day availability as well as weekend appointments for your routine care. And again, I talked about the facilities having everything in one location, which makes it easier on you. So whether you see your doctor, you go to urgent care, if you're at the emergency room, everyone sees the same information through that electronic health record. So if you have any allergies, any reactions to medication, all that is flagged in the system. So just deliver effective care and safety for you as a patient. With the electronic medical record, it allows you as a member to have access to part of that record. You can see your past history of appointments. You can, if you forgot the instructions your doctor gave you, you can go in there and review them. You can also communicate with your doctor for routine questions. If it's urgent, please call. You can book appointments, cancel appointments, order prescription refills, and have it mailed to your home. You can pay bills and view statements, as well as my favorite is viewing your lab results and your doctor's notes. So when you view your lab results, I get my lab results once a year, and I can see that they're in normal ranges or if they're slightly off. And the nice thing is I can see it from year to year. So how am I doing? And that allows me to be more proactive with my care. Oh, I'm doing better this year and that kind of stuff. So a lot of great stuff. And then if you're registered in kp.org, remember you can access your smartphone or your tablet, and you can access your electronic ID card when you're seeing a provider. One of the new things is, of course, the option is to have it mailed to your home, but you can also have it picked up at one of the pharmacies. You designate the location where you want to pick it up from. But the delivering to your home, the postage is at no cost. But if you prefer a same day or next day delivery, that is now available. It is available at a fee, but at least you have the option of what your wishes are. If you travel, you're covered for emergencies anywhere in the world. You're also covered for urgent needs, which means it's not life-threatening, or threatening to your health, but you need attention. That's urgent care. You're covered for that worldwide. We do have a travel department that's available 24/7 that you can call before your visit, during your visit, or after your visit. If you have any claims to file, they will assist you with that. And this just tells you that you are covered internationally. And then, of course, in the United States, some of the additional services, which I will talk about in the next slide. If you have, again, life-threatening, threatening to your health emergency, anywhere is covered, even if you're here in San Diego. Now, if it's urgent, you can access any of the Kaiser facilities that you see on blue here. We are in Hawaii, Oregon, Washington, Colorado, Georgia, Virginia, Maryland, and DC. You can access care in any of those locations. We have partnered with the Minute Clinics, Concentra Urgent Care Centers, and Little Clinics. You see these squares, these circles, and triangles. That's where these providers are located at. You can also call the travel line and they can direct you to where you can go to as well. But the nice thing is you don't have to file a claim. You can just pay your copay, wherever your cost share is, and you don't have to save everything and file a claim and get reimbursed. You paid your copay and you're done. The Minute Clinics and the Little Clinics have pharmacies, so if the doctor gives you a prescription for that visit, you can use those pharmacies and just pay your copay for that visit. Last year, towards the end of the year, we have partnered with the Cigna PPO network, and they also offer urgent care services. And you can access this on kp.org/travel or call the travel line, and they'll let you know the providers are in that network for that service area. And this works the same for students. If you have a student that is in any other Kaiser location, they can be seen for urgent or emergent needs. If they're in the Kaiser service areas, they can follow up with routine care there. If they're outside of the service area, urgent care and emergency is what's covered. Either one of those, we have that 24/7 virtual care clinicians that are available. They have licenses throughout the United States that they can call and get connected with a clinician that has access to the electronic medical record and can help you with your need at that time. And these are available at no cost with the traditional HMO plan. If it's the high deductible HSA plan, there will be a small fee. So because we have the electronic medical record, we are very focused on prevention, and we can see that you need your preventive care wherever you go within Kaiser Permanente. If it goes to dermatology, you go to optometry, any Kaiser department, they can see if you're due for a cancer screening or physical and detect anything way in advance where it's not so dangerous. And we have statistics that show that 33% of our members are more likely to survive heart disease, 52% survive colorectal cancer screening, more likely to survive that, and then 20% less likely to experience premature death due to cancer. And this is because of very advanced way of how we practice preventive care. Maternity care, there's a KP.org website for maternity care that provides the different trimesters, what to expect when you're expecting. The program, we have a very comprehensive care team that follows you throughout the pregnancy and tailor your plan if there's any detection of any type of chronic conditions such as high blood pressure. They'll customize your plan. There's classes available on nutrition, infant care, just to make sure the pregnancy is healthy as well as the baby as well, healthy baby. And one thing about the KP.org website also has virtual tours and articles about maternity care as well. Mental health we have a lot of resources on mental health. Because of the demand, we've added additional providers. We have psychiatrists, psychologists, and therapists If you do a one-on-one visit with one of these providers, you would pay your cost share, your copay or cost share. If it's a group type of session, you would pay half that cost share. If it's telephone or video visits with these providers, they're available at no cost for the traditional HMO plan and a small fee if you're on the high deductible plan if you haven't met your deductible. Again, you don't need a referral from your Kaiser Permanente doctor. You can call them directly and make that appointment. And then we also have additional resources on self-care as well. This just kind of has a visual as to the different types of care, depending on where you're at. There's a new telephone number for the Southern California area. This is a new number that members can call and they can direct them to the right care, depending what it is. But if our members are seeing their doctor, the doctors are great resources, specialists as well. If it's a 911 type of emergency, life-threatening, threatening to your health, then the emergency care is available as well for that. And I'll talk a little bit about the wellness programs available that covers this part of the presentation. And again, this is just a different way of looking at it: primary care, specialty care, emergency care, and then all the different wellness resources, which I will talk to you right now. Now, self-care apps. If you go on kp.org and you're registered and you go to self-care apps, you will find these different applications that are available at no cost to you. If you download them from your kp.org account, you have to set up the user ID and password, and then you can take advantage of accessing them on the mobile app, smartphone, or your tablet or your computer. And basically, the Calm app is very, very popular. If you were to download it, and it's the upgraded version, so it would have a cost if you just download it from a regular application. The Calm app is for meditation, practicing mindfulness, also good for helping you sleep. My son uses it to help him sleep. And then also sleep stories for children. I have a colleague of mine that uses it for her children to help them sleep as well. The Ginger app is rather new, that we're new offering, and this is basically the same, a lot of the same things. It's texting one-on-one with an emotional support coach that's available 24/7. And the Ginger app is, once you sign up, it's available for 90 days. And then for the rest of the year, first of the year resets and you can have it for another 90 days. The My Strength app is more for changing behavior, and it's to strengthen your emotional health. So it's basically tracking tools. Depending on what your target is, it'll help you with that. And that one was approved by our clinicians, making sure it's a safe application that we can offer to our members. Now, the Ginger app, just a little bit more of that. Again, they're available 24/7, and you get it for 90 days, and you just discuss goals and challenges with these clinicians or coaches. And these coaches, you can create action plans, and after your session, a texting session, you get a recap of your learnings. And it has skill building tools and a library of over 200 activities. So it's very, very popular. Again, available to you at no cost. It's for grief, low mood, issues with work relationships, and reducing anxiety. So the next few slides is additional information or resources on wellness, taking care of yourself, not just when you're sick, but also when you're healthy. There's a wealth of resources on wellness. We have another app called the Class Pass, and the Class Pass has over 4,000 on-demand video workouts, and they're free. They're on-demand fitness classes that you can do take advantage of. Pilates, kickboxing, cardio, strength training, dance, yoga, and so much more. Again, it's available to all our members at no cost. It also has reduced rates for fitness centers throughout the community. That's also available. Telephone coaching. We have this great resources, wellness coaching on nutrition, fitness, weight reduction, stress reduction, and smoking cessation. You call and make an appointment. Your first appointment is a little longer, about 20 minutes, to set up your goals. And then you start talking to an expert in that particular topic. So if you pick nutrition, you'll be speaking with a nutritionist. And these experts have access to the electronic medical record, which means that if you have any type of chronic condition, such as high cholesterol, diabetes, high blood pressure, they tailor your plan, and you can meet with them once a week, once every 2 weeks. It's all up to you, and you can adjust your goals as you go. But it is a multiple session type of program with coaches that are live and over the telephone. And kp.org/recipes, over hundreds of healthy cooking recipes that you can tailor depending on if you're vegetarian, whether it's lunch or dinner, or you want it to be kid friendly. You can browse and find those recipes that work for you. It also has meal prepping advice. And if you are on a plant-based type of diet, you can also have selections on those as well. Health education classes, there's lots of different classes available for you. Some examples are sleeping well, taking care of your heart, emotional health, the healthy balance class. All these are available at no cost, but the majority of them, there's like over hundreds of classes that you can take. Most of them, again, available, part of your benefit, so you don't pay anything. There's a few classes that did go back to in person, but the majority of them are still virtual. I think they're still transitioning back to in person, but you'll see that some of them will still be virtual. Again, 100% covered, and just so many different topics that you can take advantage of and learn more. You also have web-based coaching. You fill out a health assessment online, and then you can join interactive programs, keeping your stress in check, sleep better, so many different nutrition, so many. And a lot of these do work better for a lot of us. We prefer web-based over telephone coaching. Some of you may want to do both. That's up to you. These programs are yours. And then discounts through the Choose Healthy program is through American Specialty Health, a partnership we have with this provider. You can get discounts on chiropractic, acupuncture, and massage therapy. The discount is about a 25% discount. You can call them directly and make an appointment, and you'll automatically get that 25% discount. Through this program, you on this section of the Kaiser Permanente website, there's articles on health articles and tools that you can access. There's also discounts on equipment for fitness as well. There's so many things available right there. The also Active and Fit, it's a $28 a month program that you're joining a fitness center, and it has 12,200 fitness centers nationwide that you can choose from. It's $28 a month with a $28 enrollment fee. And I believe you have to pay for the upfront when you sign up for the first 2 or 3 months, and then get started. But you can change the fitness center from one to the other, depending if you wish to join a different gym. But you can do a browse and do a access by putting your zip code or city, and just say you want it to be 20 miles radius, and it'll download a directory for you. And I know that LA Fitness is in there, Curves is in there, The last time I looked, 24-hour fitness was not in there. So those are just some examples, but a lot of the very popular fitness centers are part of this partnership. A lot of you may be familiar with this wellness center. The Positive Choice Integrated Wellness Center is available to the public. They do a lot of wellness seminars, fitness videos, breathing exercises that are free to everyone on their website on the bottom that you see on the screen. They also have fee-based type of programs on the full liquid diets to have a liquid, have meal plans or just basic meal plans. They have mindfulness programs and so many other new programs that they offer. This is a great resource that's in the Garfield Center, which is not too far from the Claremont Mesa Boulevard facility. They do have satellite offices in Otay Mesa, East County, and the San Marcos location, where they do have some of these classes available there. You can go on the website to see what they offer. Again, there's a lot of free services, but they also have those fee-based weight loss programs as well. So a little bit about your benefits. Now, you will continue to have the two different benefits, the traditional HMO benefit, which is the richer plan, and then the high deductible health plan with the HSA qualified. That's packaged together where you can set up an account and save money on taxes. So we'll talk a little bit about that right now. The traditional HMO, there are no benefit changes. This particular plan does not have a deductible. And your preventive visits, telephone visits, video visits, your labs, your radiology are all covered at 100%. Your doctor visits, specialty visits, and urgent care, as well as outpatient surgery, it's a $25 copay. Very rich plan. Hospitalization, it's a $100 copay per admission. It doesn't matter how long you are in the hospital, it is per admission. If you go to the emergency room, this is for life-threatening, threatening to your health type of situations. It's a $125 copay. If you're admitted to the hospital, that copay is waived and you're subject to the hospitalization copay. Your prescriptions are a $10 copay for your generic medication and a $30 copay for your brand medication. And remember, for your maintenance medication, you pay 2 copays and you have it mailed to your home and you get up to 100-day supply. So nice and easy, save some money and a trip to the pharmacy. The HSA qualified deductible plan, there were changes. This is a program, a product that's regulated by the IRS. So based on the new IRS rules, the deductible did change to $1,600 for an employee only rate. And for a family, it's $3,200. Even if it's one person in the family, it's $3,200. So that's the new deductible starting January 1st. The maximum out of pocket is $3,200 for employee only. If it's a family, it's $6,400. And if one person in the family reaches $3,200, that means that that person, if it's the out-of-pocket maximum, that person has paid their co-insurance, their deductible, and if that person gets to $3,200, their covered services are covered at 100% all the way to first of the year, and then it resets and you start all over again. So the way this works is you're subject to the deductible upfront. So you pay 100% of whatever services you're receiving. Once you reach the deductible, then the benefits kick in. Preventive is covered at 100%, but your doctor visits, specialty visits, x-rays, labs, hospitalization, surgery, and emergency room, you would be paying 10% of the cost of that service until you reach the out-of-pocket maximum. Now, your copay for medication is a $10 copay after the deductible, or a $30 copay after the deductible for your brand medication. And you can take advantage of the mail order. Again, it's 2 copays and you get up to 100-day supply. So again, the only changes to the high deductible plan is the deductible slight change went up slightly, as well as the out-of-pocket maximum. With this plan, it's really interesting because you set up an account and opt-in is offered to you, which is part of the county, and you put money in there and you can save the money on tax-free dollars to pay for your covered services. And you can save money on that. And I think opt-in just had their meeting that can talk about more how that works, but definitely call them if you have questions pertaining to the bank portion of this program. I'm going to stop here, Nidra, to see if there's any questions.
Yes, Charlotte, one question did come through. Do we still need to make an appointment before we go to urgent care?
The urgent care is available on a walk-in basis. And if you make an appointment for same-day appointments with your doctor, those do need to have an appointment to avoid waiting long. But urgent care is on a walk-in basis. I think they give you, they have that capability where if you're planning to go sit at the courtyard, they can text you and then you can go in there in case it's, flu season is coming, so it may take a little longer. But they do have that text capability where they alert you to come in to be, so you can be seen. Hopefully that answers the question.
Thanks, Charlotte. Those are all the questions we have for now.
Okay, so I'll continue. And again, we are here for you for the next few minutes. If you have any questions, we can respond the best we can. Okay, so this, if you decide to be on the high deductible health plan, you do have additional services on your kp.org account. You have the ability to track your deductible, track your out-of-pocket maximum. There's a real sophisticated estimation tool that you can use if you're planning a procedure. Let's say it's knee surgery. You plug in the knee surgery information and it will take into account where you're at on your deductible, where you're at on your out-of-pocket maximum, and what your benefits are, and it'll let you know what your cost share would be. Also, you have the website that has additional resources as well as their own dedicated line on the screen as well. They do work with you if you're planning a huge procedure that's costly. They do payment plans, so call them if you run into that situation. And here's just an example of what the cost estimation tool looks like. Again, it just gives you a nice picture of what that service would be, what are the popular searches, and it does record any history of what you've estimated in the past, so you can just go back in there just to have a look, and you don't have to go through that whole process of doing an estimate. But it does take into account your deductible and your out-of-pocket maximum when you're doing the estimation tool. And this is just an example that once you're after your visit, you are sent an explanation of benefits. And this explanation of benefit basically gives you the same information that you have access online, but it provides you just detail of description of who you saw, the provider, what the plan paid, what was part of the deductible, and what your cost share would be, and a little bit of the glossary of each of the terms that are used. You do have a dedicated microsite available to you that you can look at. It has a lot of the same kp.org features, but it's more customized for you. It's for San Diego. Some of the things that you may have questions on, has a video on your high deductible health plan and how it works. It also houses your benefit summaries as well as your SBCs and your evidence of coverage as well. This is just letting you know that there are third-party organizations out there. They're reputable, such as the National Committee for Quality Assurance, the HEDIS, Healthcare Effectiveness Data and Information Set. They're looking at the quality of care of our members, preventive care. They're looking at customer service. They look at so many different aspects. HEDIS has 74 different areas where they are sort of auditing, and they rate the health plans. And Kaiser has got top rates with the NCQA, 7th year in the row. The HEDIS, we do always score high. Top performer with the HEDIS report as well. You can find this information on kp.org if you're interested, but it just tells you that you're getting the high quality of care on your health plan with Kaiser Permanente. Here's a snapshot of some of the locations in the Northern California area. And then here's a snapshot for the services in the Southern California area. And then some of the newer facilities, we do have partnerships in place, as well as the Claremont Mesa Boulevard. It's 3 years old now, but they still have it here. It's now open. And then on the bottom, we have the new San Marcos Medical Center that opened about a month and a half ago. And it has emergency room, base, intensive care units. Here's a QR code that you can browse. It has the virtual tour that you can see. It has private rooms, especially for our moms, labor and delivery. It has ICU for babies, neonatal ICU, robotic surgery, technologically advanced, very similar services such as the San Diego Medical Center in the Claremont Mesa Boulevard. In addition, you have additional resources, additional options. We have partnered with Target clinics throughout Southern California. They handle minor injuries and minor illnesses, and they're available Monday through Friday and 9 a.m. to 7 p.m. and then Saturday and Sunday from 11 to 4. They do take walk-ins. You would pay your cost share, whether it's a copay or a percentage, and you'd be seen by a Kaiser provider that has access to the electronic medical record. So your service, your appointment there is registered into your health record. You can use a pharmacy at that time if you're given by a prescription by the doctor at that time for that visit, and just pay your cost share. Any refills or any follow-ups would have to be with your Kaiser Permanente doctor, as they only handle minor injuries and minor illnesses. And you can see right here for San Diego County, we are in Chula Vista, Encinitas, the Mission Valley area, Santee, and Vista. So it's sort of scattered throughout the county of San Diego. If you're planning to join Kaiser Permanente, we welcome you. We have an onboarding team. They're experts in transitioning you over to see your new doctor, establishing yourself with a new doctor, and making your first appointment. They'll assist you with transitioning your prescriptions as well as your medical record as well at kp.org/new member. And just in summary, I talked about the convenient ways to choose Kaiser Permanente and get care at Kaiser Permanente, and some of the great things that we do. We're very proud of. We have also the membership perks and the Choose Healthy programs and the wellness tools and resources available to you. And thank you so much for having us. We're here if you have any questions. If you have questions afterwards, you can contact the County Benefits Division. They're equipped with a lot of the, they're all very knowledgeable about Kaiser Permanente. We also have member services for you who are current members as well. Thank you so much. I'll go ahead and turn it over to Miss Nidra.
Thank you,
Sorry.
Charlotte. No
Yes.
problem, no problem at all. A question has come through. If you can assist us with the 24/7 phone number to call for nurse advice, especially
The nurse advice line,
Yes, yes.
that would be the KP on call. So, let me see, where's my, I didn't have it there on the screen. Let me see, I can give that KP. KP4, it's KP4 care. I have 1833 KP number 4 and then care.
Okay. Type that in the chat real quick. So if I can repeat that, it is 833 KP, the number 4, and then the word care.
Yes.
Okay, perfect.
And then don't forget you have the Get Care Now, that if you're in your Kaiser Permanente account, you click on Get Care Now, you are entered into a queue and you can speak to a clinician available 24/7, and whether it's over the phone or video.
Thank you for that, Charlotte. Okay, I just put the phone number in the chat for the what is that you refer to it as KP Care? It's a nurse line, similar to a nurse line, correct?
It's
KP
the
Care.
appointment line, but after hours it reverts over to the advice nurse line.
Perfect. Thank you. That's very helpful. Well, I don't see any other questions in the chat here. I believe, let's see, we may have answered all of the questions. And you're all more than welcome to reach out to the Employee Benefits Division or your benefits ambassador during open enrollment if you have additional questions, especially regarding the plan. I know there was a lot of information provided today, so feel free to reach out to, again, the Benefits Division or your department benefits ambassador. So at this time, we would like to conclude this webinar. I would like to thank Charlotte for making time in her day and thank all of you for joining us as well. Have a great rest of the day, everyone.
Bye-bye.